Hi, this is Dr. Paul Goldberg of the Goldberg Clinic in Kennesaw, Georgia. Today we are here with Jocelyn Ogden and also with her brother Dan Helgerman, right?
Yes.
Yeah.
Yes.
And Dan actually has been a student of mine at Life Chiropractic College. He's taken some clinical nutrition courses with me and referred his sister Jocelyn to us. It was about when you came in back in September of 2013, right? And Jocelyn is from Arlington, Virginia. And when you came in, Jocelyn, what were the kind of issues that you were having that you wanted our help with?
I was experiencing a lot of bloating, hemorrhoids, achy joints and pains, severe depression off and on, sometimes seasonal depression. I just felt awful. I felt like I was basically deteriorating and slowly dying. And
you're how old now?
I'm 24.
24 years old. And Jocelyn, how long had you been having these symptoms for?
The depression started when I was a young teen, and then slowly after that, probably I started to get some symptoms of bloating when I was 16, and then the symptoms just got worse and worse, and then within the last year, I developed extreme hemorrhoids where I suffered daily, and I just was very paralyzed almost by the pain.
All right, so this had been for a period of approximately 10 years. And during those 10 years, what had you or your parents done to try to resolve these issues, these multiple issues for you?
I went to a gastroenterologist. I went to a therapist to take antidepressants, and I tried different diets, but there wasn't much that really helped. Any of the medication that I took didn't really solve any of the problems.
So you actually suffered with these problems throughout your teenage years, throughout your youth, and then when you were about 23, Dan referred you down here to us, and you came down here to the Atlanta area to our clinic in Kennesaw. We did an evaluation on you, and we put you on a program at that time. What kind of results have you gotten in terms of the depression, the stomach aches, the fatigue? You had some weight issues also, as I recall. You had aching of your joints. What has been the overall results? And we're looking at, I think you actually started a program with us, and we start evaluating in September. You started a program in October, and this is now January of 2014. So during that time, we got October, November, December, January, about 3 months after the problems have been 13 years long. What has been the outcome for you?
Within the first week, I started to feel like a relief. I felt a little bit more energized, but I really started to feel better. By a month, I started to, my symptoms of bloating, I did not experience hemorrhoids, and my depression that I was feeling kind of started to lift. I started to really feel a lot of results after a month, and I basically feel almost 100% better. It's been like a completely 180 transformation. My fatigue is non-existent anymore, and I lost a significant amount of weight, and I have...
How much weight did you lose?
25, 26 pounds, it depends.
About 26 pounds in 3 months.
Yes, and so I feel
Did
a lot
I
better.
tell you I was putting you on a weight loss program?
No.
No.
Definitely
You
not.
don't do that.
And I've really, my whole lifestyle has changed, and I've been equipped to understand what to eat, and it really actually makes me feel better.
Yeah. So, and what we like to hear is just like what you said, you now be able to take control over your own health. You have been on drugs in the past, medications that were prescribed in the past. How many drugs are you on currently?
Just one, and that is for hypocalcinuria.
Okay.
And I have to talk to my medical doctor to get off of that.
How many medications were you on over the past 13 years?
I don't even know. Probably 5.
Okay.
But I'm just very against medications, so.
Okay, so you were on approximately 5 or 6, about half a dozen medications, and right now you're down to 1, which you're slowly getting off of. Excellent, okay. And do you feel at this point that you have gained information about your own body through what we've talked to you about, through the testing procedures you've had, that will enable you to become empowered and now take care of your own health?
Completely, yes.
All right, that's what we'd like to hear. Now, there was one thing, and Jocelyn is here today with Dan because she's having a re-examination, as we do with our out-of-state patients. She's come back after approximately 2 or 3 months, and we re-examined her, we rerun a couple tests, all of which are looking great. And Jocelyn's a very, very forthright person, and she was telling us that many women experience these ups and downs in moods that are largely hormonal in nature. And you experienced that, and we did not put Jocelyn on any hormones. In fact, we are usually very much opposed to that, all the bioidentical and other hormones that are being used. We didn't put you on any hormones at all, but you did, and I won't put words in your mouth, but you had a number of shifts in your hormones every month, didn't you? Could you tell us just a little bit about the normal shift in the way you felt hormonally, which expressed itself emotionally with you on a month-to-month basis?
Yeah, over the last 10 years, like I said, I struggled from depression, but also during a month-to-month basis, I would extreme shifts of emotion, probably due to the shift of hormones that women experience during a month in their menstrual cycle, but I felt like mine were a little bit more extreme, and whenever mixed with my depression, I would have very, very low lows, and then my high highs would feel very extreme. And now, since visiting Dr. Goldberg, and being put on eating a lot differently and going through this whole treatment, obviously my hormones haven't changed in my biological makeup, but I think that my normal is for my psyche and my emotions have changed, and it's less extreme, it's a little bit more even toned, and I do get sad, I'm an emotional person, I am still moody, but I'm not extreme, and when I get sad, I don't get low depressed, and I think that I can definitely acknowledge that. I don't know if my husband can tell the difference, but
your husband knows the difference in the way you look and so forth.
Yes,
he's appreciative of that.
He's noticed, a difference in how I look, and I think he's noticed a different way in how we even communicate too. Just because I think that I'm just more consistent as a person, and that helps my overall health.
Yeah, and I think it's very important, as you point out, to understand that the depression, the anxiety, and other mood shifts that people have, both men and women, are oftentimes certainly reflective of things that may be going on in our personal lives, but they're also reflective of our biochemistry. And when our biochemistry improves, then our mood is going to improve also. And so we hear Dr. Tenner and myself at the Goldberg Clinic are not in favor of all these various psychotropic drugs that people are taking for anxiety and frustration and depression, and suicidal tendencies. We understand that in extreme circumstances they may be necessary for short periods of time, but we always feel that first, or at least at the same time, these questions of biochemistry, which affect our nervous system and our minds and our emotions, also have to be looked at, because here you see Jocelyn, in just a period of just several months, has already found that those big shifts that she was having have become much more minor shifts. And we all have those minor shifts, those waves that we have, but certainly want those shifts to be minor and be able to be, rather than a roller coaster, to be small shifts that can be easily handled on a month-to-month basis. And I've in fact encouraged Jocelyn that this is something she might want to write a little bit about, maybe even to author something, because so many women suffer with these mood shifts every month and are put on antidepressants of a whole variety of types. In fact, the numbers are now pretty close to about 1 out of every 10 women in our culture at any one time are now on some type of antidepressant drug. And we don't see this as a good solution, and in fact there are many adverse consequences that can result from that. So I want to thank you, Dan, first of all, for referring your sister down here. And Dan, as I mentioned, is a student and will be graduating in about a year, and is going to, I think, make a very fine doctor of chiropractic. And Jocelyn, also thank you for sharing your story with us, which I think is a very, very important one.